we should have done a better job providing more public information. All the deaths in the nursing homes and in the hospitals were always fully, publicly, and accurately reported.
New York Governor Andrew Cuomo admitting the state made mistakes in releasing data on coronavirus deaths in nursing homes, but stopping short of a full apology. The governor insisting deaths at the height of the pandemic were not underreported. NBC News correspondent Ron Allen joining me now from New York City. So, Ron, Governor Cuomo blamed a toxic political environment and disinformation for this delay in counting nursing home deaths. Can you explain that and what else he said?
Well, he was talking about the reaction and the criticism that he's received as being part of this toxic political culture and disinformation about what was actually going on. New York State was reporting deaths that happened in nursing homes only, whereas if a patient or a resident left a nursing home and later died at a hospital, that was not counted in the nursing home tally. Other states do it very differently for the most part. And Cuomo's critics are accusing him of trying to keep the numbers in nursing homes way down, low, because he wanted to keep the numbers very low. The other thing that's in the background of all this is that you may remember back in March, there was a very controversial directive whereby residents of nursing homes who left the nursing home and went to a hospital because they had COVID, and while they were recovering, then they came back to the nursing homes, even though they still had COVID, because the nursing homes said that they could cohort them and separate them and so on and so forth. But a lot of people, a lot of families who lost loved ones in nursing homes blamed that policy for the deaths of their loved ones. Cuomo says that the facts, as he says, are that most of those nursing homes already had COVID, so that people coming back were not bringing it, that the illness was brought into nursing homes by staff and by people coming and going who were in many cases asymptomatic. Remember, this is back in March and April when we're still learning a lot about asymptomatic spread and so forth. So it's not just about counting the numbers. It is about counting the numbers, and the problem with counting the numbers and the way they just increased by 50% in terms once the state attorney general got involved in it is that a lot of families feel that there's some deception there. They feel that the state hasn't been transparent, and if they were hiding these issues, there's a lot of concern about what else they might be hiding. Allison?
I know, Ron, you spoke with some people who lost family members in New York nursing homes. What are they telling you? What do they want to see here?
They want to see investigations. They want answers. This is perhaps one of the most tragic aspects of this whole pandemic. The number of people who lost their lives in nursing homes is about a third of the entire toll across the country, and very high here as well. People want answers. They're mourning. They're grief-stricken because of the way this happened. Remember, nursing homes were closed. People couldn't get in to see their loved ones because of safety protocols. And then there's that issue of residents leaving the nursing homes, going to hospitals, and coming back. That's a big concern of a woman named Vivian Zayas, who we interviewed. She started an organization called Voices for Seniors, because she's so concerned about how her mother was treated. Her mother died at a hospital, nursing home about a year or so ago. Her name is Anna Martinez. And since then, her daughter has just been on a crusade because she just doesn't believe things the governor's saying. She also doesn't believe things the nursing homes are saying. And here's what she had to say in reaction to Governor Cuomo's comments that none of this needs to be investigated. Here's what she had to say.
And I believe there's nothing that he can say that will convince us at this point that he's been truly transparent. And we're calling for an independent federal investigation so that this can be looked at in a deeper way, because for some reason seniors are treated as disposable. So we're not just solely saying Governor Cuomo is the only one to blame, but the questions are why, if these facilities are ill-equipped to handle COVID positive patients and these vulnerable seniors, do we then give these facilities immunity?
There are a lot of nursing homes and long-term care centers that are facing lawsuits because of what happened, so they're not completely immune. And in her case, in their family's case, her mother went to a nursing home after having knee surgery, and she went there for rehabilitation. They thought that she would only be there for a matter of months. It turned out to be the end of her life there. So again, so many families are just desperate for answers now a year later. And again, this continues. There are still problems at nursing homes where there are still COVID problems, even though they're testing the staff a couple times a week and the staff are and residents are getting vaccinated. It's still a problem.
Ron, we know it's not just the families who want answers. Lawmakers on both sides of the aisle looking to have an investigation. Do we know what's next? Is that something you expect to launch in the state legislature?
Well, the state attorney general is still investigating all this. Remember, she is the one who came up with the numbers and confronted the governor with the numbers where the deaths in nursing homes were 50% higher, as many as 15,000, not the 9,000 or so that the state had been reporting. And the question is, was that really done as a reporting measure, or was there some attempt to cover up something? The governor has said that during that time, when they were asked for numbers, they were also caught up in a federal investigation, a federal inquest into what was going on in New York, and they focused on that and didn't provide information to the public in the state legislature. It still took many months before the public and the state legislature got the information that they wanted. So there are many calls for investigations. There are calls to limit the amount of power that the governor has during this emergency. There's just a lot of frustration, a lot of feeling of deception, and of course, this is happening to a guy, Governor Cuomo, who has played a very prominent role, very leading role during the whole pandemic. Those briefings that have been televised, he's been the facts governor, if you will. He wrote a book on it, literally. Yeah. And some people wonder why he was writing a book when, in fact, he could have been providing this other information. So there's that too. But his image has taken a big hit. I even saw one report suggesting that, public opinion polls, he's taken a dip because of this. But this issue of nursing home deaths has been the thing, as much as anything, during the course of this pandemic that has been a problem for him, to explain the numbers, to explain that policy of returning COVID patients recovering back to nursing homes. He says that he was following federal directives, federal guidance on that. But it's just and it's such an emotional problem. It's such a, these families are just grief-stricken, and they want answers, and they're not getting them.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.